HealthWish is a series of conversations about the state of healthcare in New York City's fabulous fifth borough, Staten Island. Our goal is to raise issues, raise awareness, and raise health. Because when we raise health, we raise everyone. When faced with breast cancer, a patient needs to feel they have a physician and staff who are both precise and caring. Learn more about Staten Island University Hospital's amazing team that tailors each treatment with personalized care. Give it a listen.
And I think this is an important point. If you have breast cancer and you go seek that second opinion elsewhere, how often are they actually changing the plan?
Very few times. Once you have, so what we do is we really tailor every person's care according to their situations and to their wishes. Some lumpectomy for one patient may not be something that another patient wants to have. So we take our time, have a really good conversation with the patient and really see what is it that from the medical point of view would be the best recommendation and what is the patient's wishes. To me, that's incredibly important. So because of that, really the number of times that the opinion changes is incredibly small.
Yeah, and even if they're slightly different, like the chance of you going somewhere and one place giving you oh yeah, you have, we're going to treat this aggressively and you have a 90% chance of cure, and the other place saying, no, we're going to do palliative care and actually just try to maintain the tumor. It's incredibly rare that you would have that kind of a difference of opinion.
That's true. And the systemic therapies that they get pretty much is the same thing.
There's no special drug that only works on the island of Manhattan.
No.
Yeah,
No.
It's just the way it is. It's
Exactly.
the same drugs. You're getting them the same way.
Exactly.
You're getting the same standard of care. I'm sitting next to the guy that was one of the foremost surgeons in the city of Baltimore.
Thank you.
Right?
Yeah, at Hopkins, I was the other side of the doing second opinions. We provided, and for the most part, we said, okay, yes, we agreed with that. So it was very, very few times that we say, even that, we'll say, okay, we will do it a little bit differently, but then again, go back, have a conversation with your physician. Exactly, and then, they can do the same thing over there. This distance of traveling back and forth, when you get the systemic therapy, there are days that it's going to be a little bit rough. It's not easy to go through the process of chemotherapy. And God forbid, if you need to go to the emergency room, you need to seek care. Now, traveling, quite a distance to seek that care is not easy because you don't even, feel well for it. So in that sense, having somewhere that is close to home, I think is incredibly important.
That's actually a great point in that if you do have something that doesn't go exactly as expected, being in a place where the team is taking care of you can actually see you is huge.
Yes.
Right? It's being able to, again, going back to having worked in an emergency department, when I can call the person who did the case and actually ask about, hey, should I be worried about this, as opposed to somebody from, a couple of rivers away, it makes it a much more complicated process.
Exactly.
You have a hobby that you genuinely love, and I've also been told you're actually exceptionally good at. You're a baker.
Thank you. Yes, I do pastries. I'm a pastry chef. Amateur pastry chef.
That's a very detailed, minutia-driven, and then pastry is to a different level, where then you're taking all the different steps in baking and then actually turning it into a real piece of art.
It does have a lot of similarity to surgery. It's very methodical. Of course, much less stress, but very methodical, very kind of like a detail-oriented, and being a surgeon, perfectionist essentially gives you the great results. And you making a small mistake, you're going to see the result at the end. So because of that, every single case in surgery has to be absolutely the most important case that you do, the most important thing. That's what I always teach the residents, students, and the fellows. This case is the most important case of your life. Same concept essentially goes with the pastry. Everything has to be methodical, has to be perfect till you get the final results. But again, in a much, much more relaxed environment. So, but yeah, I do love the baking pastries.
I just want to take it as an aside, essentially, as I'm hearing you talk, is the one thing about you, when anyone spends a little bit of time with you, is that you're a normal guy, right? You can have a normal conversation. And it's interesting because when you read reviews from patients about you, this really comes through, this ability to connect to patients and to feel like you care about them.
I do care about them very genuinely. When I have patients, I treat them like as if I'm treating my sister or my mom. It is absolutely very, very close to me, and I think it's a part of my my nature. I think, and that is absolutely, I do care a lot.
So you brought a friend today.
Yes, say hello to Ed. Ed is our center's mascot because he's coming to see you today. He's officially wearing the bow tie. He goes all over the world and
jealous.
brings, yes, me too. And he brings joy and hope to our center. It's a creation of Tony and the rest of the team at the breast center. And yeah, so during Christmas he becomes Santa, and during Halloween, who knows who's gonna be this year? And that's who he is.
Thank you. Thank you for spending the time. Thank you for being interested in coming to Staten Island and bringing your expertise to the borough. I don't wish for any of you to be a patient in the breast center. The most important message for me to the people listening in this is we have amazing people taking care of you every single day. We work tirelessly day and night to bring the best possible specialists and the people that have world-renowned expertise to Staten Island, just like Dr. Habibi. And we're really excited to allow you to take care of the very needing population of Staten Island.
Thank you for having me.
Thank you so much.
My pleasure.
And let me just say, we're sitting here at the Stone House, one of Bread and Butter Hospitality's amazing sites. Bread and Butter Hospitality has been an amazing partner for us. They have run events, and they do all year round, supporting the institution and really care about cancer care. I want to thank them personally from me and really ask you to support their mission and support what they do every single day, because they really help take care of our community.
HealthWish wishes to thank our special guests, Dr. Brahim Ardolic and Dr. Mehran Habibi. Recorded at the Stone House at Clove Lakes. For more information, please visit the link in the video description. We're very interested in your health wish. Contact us at healthwish@northwell.edu. Thanks for joining us. We hope to see you again soon.